Hello everyone, and great job making it this far. This is the one where things really start to pay off, because in this one, we're going to talk about how you can use everything you've learned until now to effectively and efficiently manage interruptions with as little error as possible. This is where it all comes together with a little something called interruption management. Now, interruption management is formally defined as the detection, the interpretation, and the integration of interruptions within ongoing task performance. Within the framework of these lessons, managing interruptions means choosing the most effective and appropriate course of action for each interruption that will result in the least amount of potential for error. So now you know how to identify the three properties of interruptions. By weighing them against each other, you'll be able to choose the best possible interruption management strategy. For any interruption you may encounter, there are 4 interruption management strategies to choose from. These are to interrupt, to negotiate, to delegate, and to multitask. The first strategy is to interrupt, and this is the decision to immediately switch to the interrupting task while pausing the primary task until the interrupting task is complete. Interrupting is best utilized when interruption urgency is high and the cost of interruption is low. So interrupting is the course of action that we typically think of when we visualize an interruption, right? We stop what we're doing to go handle whatever interrupted us, and then we come back to what we were doing before. However, we have to remember the basic rule of interruptions and error. Interrupting a task for any amount of time is always going to increase the likelihood for primary task error. So by choosing to interrupt, you are accepting some increase in the potential for error in your primary task. However, when the urgency is high and the cost is low, choosing to interrupt is often your least detrimental strategy. So let's take an example here. We have the nurse is providing discharge instructions when a client in bed 2 indicates that they quickly need help to the bathroom, right? So here we'd probably go urgency, probably like an 8. Cost is about a 4, and relatedness is about a 1, right? So obviously the patient can't go to the bathroom by themselves. So, and we can't let them just hold it because that would be very, very bad. So we have to leave what we're currently doing in order to go help them, because the cost of providing discharge instructions, while that's very important, we can still come back to that later, and taking them to the bathroom is probably not going to take any more than 5 minutes. So we interrupt what we're doing, we say, I'm sorry, we go over, help them with the bathroom, come back, provide the discharge instructions, everybody's happy. So the second strategy is then to negotiate, which happens in the almost exact opposite of interrupting. Negotiating involves the continuation and completion of the primary task after arranging a later time to attend to the interruption. So in other words, you finish the primary task before you engage the interrupting task. Negotiation is the most optimal strategy when interruption urgency is low and the cost of interruption is high. Again, the exact opposite of what you do in interrupting. Negotiating is most effective when the interrupting task does not need to be handled right away, just period. We could even just say, interruption urgency is low, you negotiate. If the only true prerequisite for negotiation is that the interruption urgency be low. It needs to be possible for you to completely finish the primary task before attending to the interrupting task without any worry. So due to the basic rule, it's unwise to switch away from the primary task if there's no good reason to do so. So we kind of want to, a little bit of the point here is that we're trying to avoid switching away from our primary task, because when we switch away, we risk forgetting where we were, forgetting what we could be doing, messing up something when we come back. All those things are possible anytime we choose to interrupt. Negotiation completely avoids this. So of course, this is the optimal situation to be in. The interrupting task doesn't actually need to become an interruption because it's not urgent. It can just become the next primary task. So this might happen in a situation where, let's say your colleague enters your medication room and they're very frustrated. They're voicing frustration about a client while you're drawing up heparin, right? This is a blood thinner. So we do not want to interrupt the drawing up of this because we could mess up. And if we mess up a blood thinner, you've got a huge problem with the patient on your hands. So this is a very, very costly thing to be interrupting. And sorry, colleague, but your complaint can wait. It's very much a 1 urgency. So in this case, we would ask our colleague very politely to wait. And we would continue drawing up heparin and then once we're done, we can then address the colleague's need. This is a little bit related though, because you do need a secondary validation to actually finish the drawing up of your heparin. So maybe you could just have your colleagues stick around a little while to give you the validation. So our third strategy is to delegate, and that bridges the gap between interrupting and negotiating by assigning another person to handle the interrupting task before you continue work on the primary task. So you keep doing what you were doing, have somebody else handle the interrupting task, it never interrupts you. Delegating is most effective when the interruption urgency is high, but the cost of interruption is also high. So this needs to be handled right away. The interrupting task, it needs done now, but you can't leave what you're doing. And the relatedness to the primary task is low, so you can't multitask them. So delegating is the best strategy to use when the interrupting task is urgent. Switching away from the primary task would be very detrimental, and it's not possible to multitask. So of course, there is another important variable in the ability to delegate, though. Another person has to be available to attend to the interrupting task. Right? If somebody else isn't available, you can't delegate. So here we are in another example. We're collecting evidence for sexual assault when the patient in the next room indicates that they quickly need help to the bathroom. So for this interruption, the urgency, once again, this is the same interruption we had before, it's an 8, but this time the cost is a 9. We cannot interrupt this for almost any reason. Like, the only reason you'd be able to interrupt this is if there's an earthquake, probably. But you can't do either of these at the same time. So the interrupting task here is very urgent. We can't leave a patient waiting to go to the bathroom and risk the consequences of what might happen if they wait too long. And it's also very important that the collection of evidence not be disturbed. So the best solution is to delegate the interrupting task of helping the patient to the bathroom to someone else. Of course, there may not be anyone else present to help. And if that happens, you need to consider negotiating or interrupting and just decide which one of those is going to be the best for that situation. And you may have already begun to guess at our final strategy from this. Our final strategy is multitasking. Multitasking is a strategy that should only be used as a last resort due to the rule of multitasking. And that is that performing multiple effortful tasks simultaneously is always going to result in a higher percentage of task errors. Very similar to the rule of interruptions. However, in many healthcare environments, especially in chaotic ones like the emergency department or the ICU, there are many times where multitasking is completely inevitable, and it's just straight up necessary. Conditions that are appropriate for multitasking are when the interruption urgency is high, the cost of interruption is high, and relatedness is high. Everything is high. So going back to our rules of relatedness, the task load needs to be low, the task modality cannot be the same, and the task proximity needs to be close in order for multitasking to even be possible in the first place. So even if multitasking is possible as per our rules of relatedness, it's only optimal when the interruption urgency is high and the cost is also high. If one of these values is low or both of them, then multitasking is not your best option, even if it's possible. So like interrupting, simultaneous task performance of any kind is going to increase your likelihood of error by some degree. So this is why choosing to multitask at inappropriate times can result in an action that is more disruptive to the clinical work than the interruption itself. Furthermore, delegation should always be favored over multitasking. If one of the tasks can be delegated to prevent multitasking, then you should delegate. This strategy exists solely as a last resort, and it should be treated as such. You only use multitasking if all the qualities are high, it's possible to multitask, and you can't delegate. So to close out this video, let's explore what strategy we might use in 4 very similar situations. So our first scenario, the nurse is documenting a routine patient assessment, but is called to the desk by the manager to discuss scheduling. Here we have an urgency of 1, a cost of 3, and a relatedness of 1. So because interruption urgency is low, you'd want to negotiate here. You complete your documentation, and then you go discuss scheduling. It's very low urgency always indicates that negotiation is the best strategy, 100% of the time. No contest. The second scenario is that nurse is documenting a routine patient assessment, but is called to the desk immediately by a manager to discuss a patient or family complaint this time. So the urgency now is a 5 as opposed to our cost of 3. So in this situation, we would actually want to interrupt. The urgency is significantly higher than the cost of interruption. It's more important that the nurse addresses the patient or family complaint quickly than it is to finish the routine assessment now, and the assessment can be finished once the interruption has been handled. Our third scenario is that the nurse is conducting a documentation on a critical incident epilepsy patient who has recently had an episode when he hears a patient scream for help down the hall. Geez, these are both bad. So we've got urgency is a 9, and our cost of interruption is an 8. We definitely cannot multitask these. Relatedness is a 1. So delegating is going to be our best option here because the urgency and cost are both quite high, and the two tasks cannot be multitasked. It would be very, very detrimental to leave in the middle of documenting and stabilizing a critical incident like an acute seizure, but patient screaming for help could be equally or perhaps even more serious. So because the interrupting task needs to be handled now, you need to avoid leaving what you're doing, and you will need to get somebody else to handle this. The fourth scenario here is that a nurse is conducting documentation on a critical incident epilepsy patient who's recently had an episode when the seizure patient's family, the same patient that you're working on right now, their family begins to ask questions about the quality and direction of the patient's care because they need to make a decision. So now our urgency is about a 7, our cost is an 8, and our relatedness is also an 8. Now this is a rare example in which you might actually need to multitask. So as in the previous scenario, it's going to be very, very detrimental to stop your documentation of the critical incident. However, not answering the epilepsy patient's family quickly could have dire consequences also. They could become angry with you, they could cause a scene, they become less agreeable later on, they could report you to management for ignoring them, but most importantly, they have to worry for their loved one and have that spiral even further. We don't want them to do that. So because these two tasks are highly proximate, they're both of medium cognitive load, and they don't utilize exactly the same modalities, it is possible to multitask these two tasks. However, talking and documenting will both require language processing, which will introduce some interference, which keeps relatedness from being any higher than an 8. So now you're prepared to handle interruptions by quickly identifying the properties and choosing the appropriate interruption management strategy. In the next lesson, we're going to go over some more factors that go into choosing an available strategy and some alternative methods in case your preferred strategy doesn't quite work out. Until then, thank you for joining us.